Good afternoon, everyone, and welcome to our third webinar in the series Propelling Education Through a COVID-19 World. My name is Jim Watterston and I'm the Dean of the Melbourne Graduate School of Education, and I'm pleased to be able to host this function tonight. I'd like to start by acknowledging the traditional owners of the lands, many lands where we're all coming from different places that we meet on today, and acknowledge the ancestors past, present and emerging. Elders past, present and emerging. And I'd like to just remind you all that this series is being recorded on YouTube, on our MGSE YouTube channel. And so for those colleagues of yours that weren't able to be with us today, they're able to access the vision of this webinar from the YouTube channel. And we look forward to having those people interact with the series through that way. You can also ask questions through this webinar today, and as we have done for the past 2 weeks, just use the Q&A function. And of course, you can also tweet using the hashtag MGSE Propel, all in lowercase letters. So as I said before, this is our third episode, and you will recall that our first episode was presented by Professor Yong Zhao, who talked about a reconsideration of the way we teach and learn, and called for the use of COVID to be the catalyst for our opportunities to change post this COVID world. And then, of course, last week, Professor Sandra Milligan talked about what students need to know and be able to do, and how those skills and competencies can be assessed, thinking about, again, a post-COVID world and what's going to be really important in that world. Today, we have Professor John Hattie, and his episode, today's episode is called Other Days of Evidence Over. John's already tweeted that out and got a bit of a reaction before we've even started the webinar today. So it's with great pleasure that we introduce John Hattie, who is an internationally renowned scholar and who's worked assiduously over his career, primarily on visible learning, which is one of the world's largest evidence-based studies into the factors that improve student learning, which has involved over 80 million students across the world. So we look forward to John speaking tonight, and thank you for making yourself available. And of course, we have questions from Yong and Sandra, and Dr. Matthew Harrison will be, who is a lecturer at the Melbourne University, will also be asking questions, and we welcome you along today too, Matt. So without any further ado, can I introduce again Professor Janet Clinton, who is the Deputy Dean at the Melbourne Graduate School of Education and our moderator for tonight. So over to you, Janet.
Thanks, Jim. Well, welcome to episode 3. As you know, this webinar series is really designed to promote our thinking about the future of education. This pandemic has forced us to think a little differently about what the world may be like. And we are hoping that this webinar series will support us in propelling our ideas and our focus on positive, impactful future for all of our children, all of our education sector. So similar to last week, our key education expert is going to speak for about 10 to 15 minutes. And this will be followed by a series of comments and questions from the other panellists and a faculty member from MGSE. And Matt is going to act as our discussant and pick up some of the questions from the Q&A that you might choose to put in place. Now, please remember to send your comments into that Q&A so we can use those in next week's episode. Remember, all of our speakers are working from home, so please excuse any troublesome conditions like internet and dogs barking, etc. Last week, we had a number of comments and questions that we've collated, and those results, like the previous weeks, will be on our reflection page on MGSE website. So what was key from last week? Again, most people have really agreed with Sandra and were really interested in the ideas of increasing our focus on student capabilities. And of course, the ideas of around assessment really stirred lots of discussion. And, there were some really interesting comments. Like somebody suggested schools will live and die by their results on NAPLAN or ATAR. So how can you convince governments or whoever has power to make a change? This was a really common thread. How do we convince people to turn the tide? And then there were questions from our teachers and our school leaders about how do you understand learner profiles? So many of these questions we're going to take to the 4th episode. Several folks really wanted to understand individual learner profiles and how we assess them. And really what they wanted to focus on was how the evidence that we might use to convince our government or our systems to focus on these students might come to the fore. And I guess this brings us to John Hattie's webinar topic. John is going to talk about multiple aspects of evidence, I believe. But, you know, his topic was the days of evidence are over. And this has fascinated many people. I was recently reading a book by Stephen Gorad from Durham University, who suggested very, very strongly that education needs to use more evidence, not less. And in fact, in the book it suggests, and in fact it was a plea, and I quote, all education is damaged when persuasive but poor quality evidence has a widespread influence, or when good research lies unused. So John, keeping that in mind, what's your response?
Well, thank you, Janet. And yes, the topic is about the days of evidence are over, and I want to argue today that they are over. The constant plea, such as Stephen Gerrard is saying, is for more evidence, usually his evidence. Can you imagine going to your doctor and having him or her not make decisions based on evidence, but by their gut feeling? Or what has happened when they've treated previous patients like you? Or say with pride, they have never read a research study since they were at university. Would you want to go to a school and have a teacher say they already know how to teach and say with pride that they've not read a research study since they were at university? And indeed say when they're at university, they were told that just teach like me. Would you want to be in a state where a minister made policies based on the belief of what best resonated with their voters, with the parents, and not policies based on the evidence of what best impacts on students? Of course not. I do indeed privilege evidence, and I would argue it has made a difference. It is listened to, and maybe we have too much evidence. Of course, we need to ask evidence about what, whose evidence, and, as you said, Janet, the quality of the evidence. And let me be clear, there are many forms of evidence, and academic research is but one form. Teachers collect evidence every day, from observing, from student assignments and assessments, from reading, from attending professional learning. And this form of evidence should be not denigrated just because it's not an academic form. Such classroom evidence should be placed alongside the academic evidence. Indeed, I think that the greatest change in the last decade has been the bringing of academic research into schools. It's now commonplace, and it wasn't before, but it's commonplace now for debates about this research amongst teachers. It's not that teachers are not critical of the research, but a premise of criticism as they read it and are aware of it. And I think this has been an extremely exciting development. But now we have so many outlets for curating this evidence. In America, we've got What Works Clearinghouse, we've got SVA, Social Ventures Australia here in this country, Education Endowment Fund, and even my own MetaX, based on 300 million students. Evidence is all around us. Asking for more evidence seems far less meaningful than asking for the use of that evidence. My claim is the days of evidence are over. The days of interpreting and implementing evidence are here. And what is needed is more attention to interpreting, evaluating, and implementing the corpus of evidence. Not being blinded by our own confirmation bias to see what we're doing now is necessarily optimal. We need to call out those where students are not making at least a year's growth or a year's progress, and to ensure that there's a robust debate in every staff room, in every teacher education program, in every professional learning session, in every department about how we are interpreting, using, and implementing evidence. Sadly, we still have people who believe in the nonsense of learning styles, think reading can be taught without teaching the skills of phonics, phonemic awareness, fluency, vocabulary, comprehension. Those who advocate there is but one learning progression that fits all students. Those who love the politics of distraction, and those who keep demanding more autonomy, more money, more. When in fact in Australia, we have amongst the greatest autonomy in our schools, and the funding increases over the past 10 years have been exponential. Maybe we should be asking for evidence about how well the past increases have been spent before we ask for more. When you define excellence, not in terms of adopting specific forms of teaching, but in terms of the impact of that teaching, we learn there are so many effective ways to teach. The high impact teachers, they use and interpret evidence from classrooms and from research studies. They teach not only the precious knowledge, but the self-regulation, the learning how to learn, and the learner profile attributes that Sandra was talking about. They enable their students to become teachers. What a beautiful, virtuous circle. In so many schools around Australia, this is happening now, and the focus needs to be on how to scale up this excellence. I would argue on the basis of many studies that about 60 to 70% of teachers and schools across Australia have the majority of their students making more than a year's progress for a year's input, and that's pretty impressive. Evidence of excellence is all around us. I think we need to stop finding fault and providing expensive band-aids, and instead reliably identify excellence and scale it up. Can we better understand how these highly accomplished elite educators think, interpret, and make the moment-by-moment decisions that leads to this excellence? And realize that it is that their interpretive and implementation thinking that makes the difference. Can we appreciate that it is these evaluative thinking skills that's the essence of our profession? And without this realization, we are moving in the wrong direction. I know, for example, the rise of amateurs in our schools, teaching assistants who have a zero to negative impact primarily because the students most in need of the expertise and evaluative thinking are given to the amateurs. In the UK, there are now more teaching assistants than teachers in schools. And in the US, of all employment categories, projected over the next 10 years, the fastest are teaching assistants. Indeed, I would argue we're at a turning point, and we need to ask, Oliver Twist, just give me more, let's collect evidence, or are we going to invest in high impact evaluative thinking educators? And this personification of excellence is in Australian schools at the moment. Not enough, not scaled up. In these last two episodes, Yong and Sandra have spoken about the current grammar of schooling. And I would argue it's worked well for the last 150 years for about 80% of our students. That is, about 80% of our students know how to play the game within the grammar of schooling. They come to class prepared, they put up their hands to show they know the right answers, and they watch the teacher work. Sadly, 95% of 5-year-olds, and I'm watching my own granddaughter at the moment, she's 4, and the excitement of her going to school next year is just enormous. She's even doubly excited because the school she's going to next year, mum and dad are both teachers. But I know by the end of primary school, whilst 95% of kids at age 5 want to come to school to learn, by the end of primary school, it gets down to about 40%. Not good enough. So yes, the model kind of works, but unfortunately, it's got many side effects. Still, the number of students who do not complete to year 12 is not good enough in Australia. And that completion rate is one of our best predictors of adult wealth, health, and happiness. Maybe COVID is the perfect disruptor if we have the courage to learn, recognize excellence, and scale up. Think of the premise of COVID teaching. You can't talk for 80 to 90% of the time. but you need to move more to triage, to listening, to diagnosing, to just-in-time feedback, the very skills in interpreting the evidence in front of you. We have to teach the students to become their own teacher, how to self-regulate, how to evaluate their progress. And we need to enact more than a gradual, more like a speedy release of responsibility from dependence on the teacher. Those students who overly depend on the teacher for their next learning move are truly disadvantaged in COVID. Parents also have learned that they need to switch their focus from ensuring that their students have outcomes and getting everything right to appreciating the language of learning, from seeing themselves as homework police to becoming partners in learning, from discussing what did you do at school today to let's work together in the struggle and hard work of learning, seeing errors and mistakes as opportunities. Surely if there's no errors, then the work was too easy. And hitting that Goldilocks principle of challenge, not too hard, not too easy, not too boring. Now, some parents have struggled to make the switch. And I remember, as I'm sure many of you, on that first day back to in class here in Victoria, it seems like months ago now, a few weeks ago, if you put your head out the door that day, you could have heard the collective sigh of relief from many parents. At least they came to appreciate the skills and expertise of teachers, and the esteem of teachers has risen dramatically. What an opportunity to use that esteem to bring back better, to engage parents more in the future in the language of learning than the written reports where it seems that 95% of students in Victoria are achieving well, putting in an effort and a pleasure to teach. I invite teachers to keep an evidence log during COVID to notice the occasions when their teaching was more effective to enable students to learn better. And together as a community, after we come back in class, to collectively debate and decide in light of that evidence on how to modify the old grammar of schooling into the new syntax of learning. We could centre our policies, our actions, and our teachings around 4 key notions that we've been using implementing our own model, now in over 10,000 schools around the world each year. We're using the DIE model to diagnose, intervene, implement, and evaluate. We start with deep diagnosis. So many policies are introduced, not asking what the problems are these policies are meant to fix. Too often, we find the failures and try and fix them, rather than discover the excellence and try and upscale it. In our diagnosis, we see evidence from the teachers, from the parents, and from the students about questions like, what does it mean to be a good learner in this class? Who's the smartest kid in the class and why? What does it mean to be a good learner in your school? How much feedback and what's the nature of feedback you get from this teacher about your progress and how to reform? And is this class of the school an inviting place to come into? From this, we reliably identify those schools and teachers with high impacts on students, form a coalition of success around them and invite them to join. We collectively decide on the interventions, when they should stop, when they should modify, when they should change. If we look for shorter, medium and long-term gains. We pay extremely close attention to the implementation. So many policies are promulgated, but never implemented, both at the state level and in the class level. And we look at dosage, fidelity, quality, and adaptations. And finally, we relentlessly evaluate to build the evaluative mindset. And we use the evidence that teachers collect in schools about their impact to make the difference. That's the kind of evidence that I think we should be upscaling. We're now working with this model with over 1% of schools in the US, many thousands around the world, and COVID's given us a chance to ask, as I'm asking you today, to upscale the pursuit and the quality of evidence. I'm also working in my role as chair of the board of AITSL and pushing national policies to STEAM excellence via the Highly Accomplished and Lead Teacher program that's in all but 2 states in this country, to STEAM excellence in teacher education by the introducing of teacher performance assessments and the TBAG reforms. AITSL has spent a lot of time creating social networks of educators to collaboratively share this evaluative thinking, promoting the national professional standards for teachers and school leaders. And there are exciting prospects in the development of resources to help schools and teachers in collecting the student-focused evidence to help in evaluative thinking and interpretations. So my message today is the days of collecting more evidence, particularly the research evidence, and curating it are over. And the days of implementing and interpreting that evidence need to be here. And I ask you, do you have the courage to focus on those already engaging in interpreting the evidence from research and from student learning? Can we move from the debate from what works to what works best? Can we use the current COVID opportunity to move all from that old grammar of schooling to that new syntax focused on learning, evaluative thinking, developing precious knowledge and learning profiles, and providing schools and systems with the resources, the time, and that focus on interpreting the evidence of their impact? Will politicians, state departments, schools of education, and every school leader, teacher, parent, and student take the pledge to bring back better from COVID, to demand that every student gain at least a year's progress from a year's input? That a revolution be advanced to privilege evaluative thinking and expertise and share that evidence of impact? That every school, every minister, and every state department be asked for at least a one-pager on how they will evaluate new policies before getting more resources for their next big idea, and that evaluation be shared to upscale success? That we focus more on successful implementation that leads to greater student growth, and that we become immersed in interpreting and implementing evidence. That's it, Janet.
Wow, thank you. So, in actual fact, the days of evidence aren't really over. What you're talking about is using quality evidence. And I guess one of the things that I'm going to want to think about over this webinar is, how do we define quality, even if it's teacher-made? So if our excellence is about utilising evidence and implementing from that evidence, how do we know what credible evidence is? Something to think about. On that note, I'm actually going to turn to Sandra. Sandra, thoughts, comments?
Yes, thanks, John. That was very interesting. And I've got a couple of quick reactions about where I agree with you totally. And I'm going to adopt today an evidence log so that I can capture how much I hate working on Zoom and COVID and all of it in the COVID times, and use it to figure out how I'm going to do my work in the future. I think that's a terrific idea. So I like that little one. I also like the idea that we should have an evaluation of policies that are put in education departments, not just evaluation of teachers and kids. So I think if we put as much effort as collecting evidence on policies, then we'd probably be in good shape. Look, the one area that I've sort of disagreed with you about, and I want to press you a little on it, I want to get more your ideas a bit more, and that's the, COVID, I think, has been a great disruptor. And when we hear the kinds of things that teachers say they're going to do, like give kids more agency in their work and try and build more on the passion of kids and the interests of kids, not just the textbook, and focus on the general capabilities, because kids will need that post-COVID. When I hear things like that, I really think that the evidence of the past that we've collected, that you think we've got enough of, is almost all irrelevant, because it was all generated in a time when we were teaching in classes, face-to-face, teacher talk, textbooks, examinations. And so all of that evidence, I hope we could sweep away, leaving us with very little left. And I'd also argue that teachers can't be asked to sort of invent the new evidence for the new paradigms, because that's not their job. You can't fly the plane and research it and alter it at the same time, which I think we're asking teachers to do. So my question to you is, really, do you really believe that everything that needs to be known is known, and that everything we need to know is in a classroom for a teacher to uncover. There you go.
Sure, and I'll quote Mr. Aristotle that was around many years ago saying there's nothing new under the sun. And my theme is that just the plea for more evidence is not going to make a difference. It's that interpretation. And unlike you, what keeps me going I used to travel around the world. As I travel around the world, is there is so much excellence out there. They're not the kind of classrooms that you're personifying, that old 1860s class. There are stunning things happening right now when we're in the regular classroom that is mimicking and supporting what we're doing in COVID. So for many of those kids, there isn't a dramatic transformation from in-class to distance. Now, not enough of them. And so there is plenty out there at the moment where they are teaching those skills of self-regulation. Like, I'm with you. I'm not a fan of student control over learning. That's something that has to be deliberately taught. And I use the phrase, I'd rather teach kids how to be their teachers, know what to do when they don't know what to do. Just giving them a book and say, going on away and learning, if that's what you mean, student control over learning, that's bonkers. And so there are some things. One of the hardest things is for kids to know when to ask for help. Now, in the old grammar schooling, that's very hard for lots of reasons. Kids don't put their hands up when they have the wrong answer. They only put it up when they have the right answer. And so there's a lot of press there. But my argument is already happening in many, many schools around this country, in the city at the moment. And so when we go to COVID, I think that we could learn a lot of that. And that the teachers that aren't using those systems, they're in for a shock, because when kids aren't with you every minute of the day and you haven't got that press over top of them, they still need to learn. And some of them are.
Yeah. How do you react to statistics like that during COVID, 23% of kids didn't even log on and were sort of lost to the system, and that teachers are worried that when they've done amazing things to get students online, in their hearts they know that the workbooks and the delivery that they're relying on aren't reflecting the excellence that they can achieve in the face-to-face classroom. So it's almost like digital 1.0 has taken us a little bit backwards, and the best teachers understand this. So, you know, I'm not sure that it's unadulterated happiness for teachers out there at the moment.
There you go again. You look at the 23%, you forget the other 67% that's out there. And if you look at the work that the independent school's done, their survey, Donna Prendergast has done, there's some stunningly good things happening. Now, I'm not saying for a second that it's all good. Yes, that percentage of kids that is higher in some areas than others that have not even made contact, that's a pretty serious problem. But I want to upscale the success. You'll also find that's coming out of the current work, and there was a big survey in the US just recently, that some of the kids who were disruptors in class, that weren't achieving in class, are achieving in the COVID world. Now, I'm not painting it's all a rosy picture, but I am saying we should look at the success of what we're having and upscale to that, not what you're doing, looking at the failing and wringing your hands and saying we have to stop everything.
I'm going to interrupt you both there, because
John.
I'm going to interrupt you later. And because I want to, Yong, you're listening to this. So John's talking about excellence, talking about change, and thinking about new forms of evidence. And Sandra's saying, well, you know, we haven't collected everything yet, and you can't just rely on the teachers to do this. It's not their job. Yong, what are you thinking?
Well, this is actually fascinating. I don't know how interesting this will be to the audience, honestly, but this is really a fascinating argument, debate, because, you know, I was just thinking about Sandra's point and John's point. You know, first of all, when you collect evidence, the context actually matters, the context, you know, because, you know, education is a human entity, you know, different ways to organize students, different ways to organize faculty, that actually matters. So you know, you have evidence in one context that may not apply to another context. I'm really into evidence. Actually, I'm very supportive of the idea about using evidence, interpreting evidence. So, but how do we collect evidence? So the context that matters. You know, for example, what works with that teacher does, let's say, one-on-one or versus 1 to 60 students. That may differ. You know, The second thing I think that gives us trouble with evidence is also, I've written a book about this called The Side Effects, What Works May Hurt. That is, in education, we have very different outcomes. We have different outcomes. We have standardized measurement of, let's say, achievement in NAPLAN or, PISA, other things. But when we have the unmeasured progress, we have unmeasured things, like, for example, curiosity, creativity, entrepreneurial thinking, and the general capability in the Australian curriculum is that, and sometimes they don't go together. Let's just take one thing. For example, if you overemphasize literacy and numeracy, then you will drop other things. And what do you think of that? That's another big thing about side effects. So if it works to improve one method, for year one student in NAPLAN in reading, but those students may drop, later on because they did not grasp the general comprehension, they may get the skills, to use John's words. So how do we think about that? That's another piece about side effects. What works could hurt. Another one which actually comes deep to my heart is the individual students. The individuals, whether you're debating about the 30% who have gained or the 70% who haven't lost, or vice versa, is that, even in medicine is trying to push towards personalized medicine, personalized medication is about, yes, we have a general probability that may apply to this percentage of people, but we know it may not work for every one of them. And in education, every teacher wants a method to work for every individual student, each and every one, and all the time. So we have long-term goals, short-term outcomes, we have individuals, we have groups. I think there's a lot of evidence. I would agree with John, but the key is right now, I think we can all get together to interpret the evidence to say, what do we want as parents, as teachers, as education systems? Because not all the approaches that may work well for one student, one context, one group of people, one outcome may not work for everybody. So that's where I think I don't know what I'm talking about, but I just want to raise those questions.
I want to react and reinforce that. Like, if you take the academic research, my argument is that they're probability statements. That if you take high probability interventions, you've got a more chance of having a success if you take low probability. But one of the frustrations is that it doesn't stop there by a long way, which is what I hear you say. And that's why I pressed the theme about know your impact. What is the impact that a high probability intervention has on a particular student? In the same way that if you have a disease and they give you a drug that has a high probability intervention, that's not the end of it, that's the start of it. And that's my argument here with evidence. So often we've seen the evidence as reified. It must be true if 300 million kids are successful. But let's look more specifically at the implementation at the local level, be it the state, the school, the class, the individual kid, and say, I want that evidence from that teacher shared with other teachers about their evidence. So it's not just their opinion, it's not their confirmation bias, but that notion of progress. And there are so many teams now, collective evidence, collective efficacy, professional learning communities, where they get together in teams to debate kids, to debate progress, they debate what expectations are. I think that's just exactly how it should be. That's pretty impressive.
Yeah, I think, John, I love what you were saying. I think that there's a big thing. I think the approach to evidence should be different for teachers, school leaders, and policymakers. Mm-hmm. I think that's very important, because policymakers, I agree with you. Like, policymakers, you have to make a bet, in essence, the high impact of this, do this. But when teachers may be dealing with individual students, I think that is where we would emphasize something different, right?
But there's another effect, Yong, that take the politicians. They're listening to the voters, not necessarily the kids. Now, there's a line through it, of course, but what appeals to the voters and the parents is going to get more mileage than what appeals to an individual kid. And that's why we get some incredible politics of destruction at that level. They do things that just don't make a difference to a kid. How many more times do we have to tinker with the curriculum? Probably doesn't affect a single kid in the country, but we're going to tinker.
Oh yeah, no, definitely. I'm not debating that. I'm more going to talk about how, like, for example, a teacher facing 25 kids, a teacher needs to treat 25 kids as 25, not 25 as 1. And then they would dare to say, okay, it's very hard to apply, I would say, statistical probability to 25 kids if you're trying to make sure every child makes progress. You can make a bet initially, but as you teach along, you would have to understand every student and draw on different evidence for different students.
Agreed.
Yong, I'm actually going to bring Jim in here. Now, Jim, you've been listening to what our three panellists have been saying, and I know you've had experience at every level of our education sector. I'm just wondering what your thoughts are.
Thanks, Janet. Yeah, I am keen to make a comment on this. I've appreciated John's presentation and I agree with all of it, except that it's a purist kind of argument, because in the real world of schools, John mentioned before about the politics of distraction. Well, the politics of distraction are real, and they affect the evidence in a sense, because out in the world of education land in Australia, the evidence is contested, confused, and contrived. And so it's hard for people to understand what evidence is agreed by all and is uncontested. And so if that was the case, then we could be like the doctor that John talked about at the beginning of his presentation, where doctors have a body of knowledge. Most of it's not contested. They know what to do when the time comes. And then doctors work in research and trying to push the boundaries, trying to take it a bit further. Well, we haven't got that acceptance yet. There are for every piece of research, there's a counter view. And so take politicians, for example, which is where we left off just then. Politicians, especially at the time of election, will create a whole lot of election commitments, which if they win government will have to be implemented. Most of those election commitments were dreamt up by 21-year-old law graduates who have never been to the bar. And so they're a hodgepodge of just weird ideas that then become the agenda for the next 3 to 4 years. And so some of those policies that you talked about, Yong, but also strategies that are implemented within schools come from a non-evidence base because they were just responding to parents, like John said. Well, what's really important here is, I think, in Australia, which is messing with our heads a bit, is that there are so many people who have appointed themselves as education consultants. They're everywhere. They're in every state, and they come up with their own pitch in terms of what they think the evidence says, and then they move into schools that are looking for answers, and for a very exorbitant fee, will then work with the staff on a particular area, whether it's whole language or whether it's a phonics-based approach. And again, I'm using that example because it's so widely contested. Yet, in fact, when you get underneath both language strategies, there's so much in common there, and the phonics bit is central to everything we do in reading, but we spend most of our life contesting it. So I guess my point is we really need to be able to identify within schools what does work, what's not contested, and do it like the medical profession, work in that space and then push the boundaries further and further. I think teachers are overloaded by a curriculum that is so full of content that they don't get enough time to engage in contested and uncontested evidence. And so we've got to free up teachers to build an evidence and research culture and give them the time to do that, and then create some acceptance across Australia on what we can all agree on and move forward with. I could talk for a long time, Janet, but I really feel like it's a challenging environment out in school land because, as Yong said, it's all about context, it's all about know-how as much as it's about evidence. And if you're in a remote community school, or if you're in the middle of Adelaide, then some of the context will be different. And so that same piece of evidence relies then on know-how, and it relies on the capacity for people to be able to personalise it, like Yong said. It's very complex, but it's just not as simple as whether we use evidence or not.
Thanks, Jim. And I take your point that it's not only context, but quality and what's credible evidence in what context. So it gets really complex. John, before I turn to Matt, do you have a comment? Because I'd like to bring Sandra in again just for a quick comment as well.
Well, I hear what you're saying, Jim. There's a fundamental difference, many differences, but one fundamental difference between the medical and the education model is in medicine, you can control the implementation, X percent, milligrams of this. In education, that control of that implementation is all the business. That's what we do. And I think we need to get smarter at that. And I agree with you, it takes time. And I think we need to create the time for teachers to have these debates and discussions about their evidence, their interpretation, both from the classroom and from the academics. And with, quite frankly, it's happening now in many, many schools in this country. So it's not pie in the sky stuff. It's happening right now, where there is a robust discussion in schools run by really good leaders that look at the evidence, contest the evidence, interrogate the evidence, the interpretations of that evidence by the teachers and the people in that school. And it's a very healthy environment. My point is, we need to create more space and more passion and more imperative to do exactly what's happening. And I would argue a fair percentage of schools now, just not enough of them.
Sandra, would you like to make a comment?
Yeah, yes. You know, there are always arguments about evidence. And for everything that you see, there's some evidence that it's not so. And the thing that I see in schools where things are happening really well is strong leadership that pulls together the evidence in the context of a philosophy of what they want to achieve and an intentionality about where they're going to go. So in some senses, I'd probably argue that the evidence environment to be interpreted properly needs strong leadership. So I think that's the way that we could sort of probably, I've heard each of the speakers talk about leadership, but I think that's the key in a contested evidence context. Leadership, intention, philosophy, and strength of direction, I think, is the key.
Thanks. And that's an interesting segue to Matt. Matt, I know you've been looking at questions, but I'm also knowing that you're dying to make a comment as well. And given your field, particularly thinking about inclusion, diversity, and working with kids who are vulnerable. So, Matt, could you make a comment and perhaps channel some of those questions from the chat?
Yeah, wonderful. Thanks, Janet. Wow, what an interesting, important conversation. As an early career researcher, this is just wonderful to be part of. I agree with like almost everything that John said. And I think it's wonderful that he's highlighted local excellence. I think with so many great things happening in schools right now, I strongly agree that teachers need to know what's going to work best for most students most of the time. And I think they're doing that. We can already see that programs like school-wide positive behaviour support are being implemented. And you see teachers collecting data and analysing this data collectively, then looking at the research to see how they can intervene. They're talking about things like intervention, fidelity, and dosage. So they are using terms that traditionally have been in the medical model across to the education space, and they're having these really rich discussions about what sort of evidence counts. I think it's really telling that Yong and Sandra in previous weeks and John today have all touched on the need to broaden how we're measuring successful schooling. So yes, teachers need to draw on research evidence, but also this idea of stakeholder voice, particularly parents and the children themselves, is wonderful. So with all of this, I guess my question for John is, to what degree should teachers decide the evidence that informs their practice? And when should school leaders or even policymakers dictate what counts in terms of evidence?
Thanks, Matt. As we've said, evidence is not neutral. And therefore, when you ask what degree should teachers decide the evidence, I would rephrase that and say at all times they should be accountable for the interpretation of their evidence. And that evidence can come, as I said, from a variety of sources. But it's that interpretations they're making that make the difference. And I'm never a great fan when you said it all come from medicine. I remind you, meta-analysis was invented in education, stolen by medicine. The whole area of quasi-experimental control, Donald Campbell invented in education, stolen by medicine. So let's keep to education here. So yes, I think it is about teachers deciding that evidence, as long as, like everything, it's critiqued, it's evaluated, it's replicated. The same demands we make of your academic research, Matt, I want to make of in schools. Hence the importance of the collective notions of what is the nature of the evidence. I want to see kids' progress over time and say, how does that relate to what's happening? And then your question about school leaders deciding what counts, again, as long as it's up to critique. All evidence should be up to critique. And yes, I want them to look at the nature of it. I push the DIE model that they have a process of doing that critique, doing that diagnosis, doing the choice of interventions, during that modality of implementation, worrying about the evaluation. And I look to your area, Matt, special education. You guys kind of got it right many years ago. You know, your focus is on learning interventions. Your focus, as you said in the positive behavioural development, is on evidence of the impact of teachers. And so I think we can learn from you. Sometimes it doesn't work the other way around, but there's a lot out there.
But can I just jump in here just to add something? This is getting more interesting. I know some people may get lost why we're talking about this, but I think it's there is something I think, John, what you said. I want just further discussion about that. You would talk about evidence needs to be evaluated. The evidence needs to be understood. So I want to suggest that when we move to different paradigms of education, you know, when evidence works a lot of times within one paradigm. Until that paradigm gets broken away. So there will be, you know, in medicine, in education too, we ditch a lot of ideas. So I would like to say your title for today, the days of evidence are over, is a question mark, is very smart. So we may need to collect new evidence for new possibilities, new outcomes, new arrangements, and new innovations. And at certain times, some of the evidence will become invalid or become useless because after certain years, I know in special education, we've been debating a lot about, you know, special education is a very strange field with all kinds of very diverse, divisive, you know, field in many ways. So they have one approach, have another approach, but the overall idea I would like to suggest, there are paradigm changes, there are paradigm shifts.
Matt, perhaps it's time to have a little closer look at the Q&A, because I know there's some themes coming out there. Would you like to pick a few things out that we've got some time to do that?
Yeah, there's a very interesting, there's a couple of questions that talk about, is there enough variability in the current evidence base? So are there enough voices? I think this is research evidence in particular. I thought maybe the panel would have some perspective on that, about who we're asking in this case, or who we're studying, measuring.
John?
Well, I've got 100,000 studies in my own evidence base. That's a pretty varied viewpoint. The other irony of that, Matt, is that there's a whole debate about replication, which is the opposite of variability. And I would argue that there is an incredible amount of replication that's positive out there. And the most exciting thing, I think, happening in the last 10 years in the academic research base is the synthesis of qualitative studies, the meta-analysis in that area. That's a really exciting area that's been kind of missing. And so I think that ask for variability. Now, I don't agree with Sandra. I'm not the kind of Donald Trump that says, I'll find the 2% who doesn't believe in climate change and say, well, there's a bit of this and a bit of this. There is a preponderance of evidence. There is a major claim. There are high probabilities about some things. And so I think there is some consistency out there. It's not just a random free-for-all. And certainly then when you go into schools, it comes back to that same argument. There is variability, but it's that putting that on the table and reducing that variability about what truly is making the difference to kids is the nature of the heart of our being.
Matt, I'm going to go back to you, and then Sandra, I will bring you in, of course, but because I'm interested. There's a couple of questions coming up about teachers being at the centre of all of this, and the need for teachers to contest evidence.
Yeah, absolutely. And I think one thing that's been coming through the questions is also around how do we do this? How do we build the teacher capacity to be able to analyse evidence, and how can we improve that? I know John mentioned professional learning groups before, and I know he's talked about social media and a social media revolution. So I thought that's a really interesting theme that people want to hear more about.
Well, on that, Matt, I go to my HSL hat on, and they do a tremendous amount of social media. Teachers are incredibly connected. 250,000 hits to their website a month from Australian teachers. They talk to each other. The highly accomplished and lead teachers, like we found a few years ago that when we asked principals about the quality of their mentoring program for new teachers, 95% of them had excellent mentoring programs, of which less than 40% of the new teachers knew about. Fixing that was the wrong problem. So we created an app that a new teacher can get on, ask a question by the afternoon, 10 to 12 highly accomplished and lead teachers have talked to them, been with them, etc. 30,000 a month. What's happening out there in this world now in social media is ginormous now. And so I think those systems are there, and I want to see that used more to have this contest about evidence. And this is where highly accomplished and lead teachers, which are in all but 2 states in this country, what an incredible way to esteem excellence. What an incredible way to say to our community, we can reliably identify excellence, we can privilege it, we can esteem it. And we are listening to them very, very carefully about how they think. I think this is happening right around us at the moment. I want more of it faster.
Sandra?
Yeah, John, I just reckon you're being a bit Panglossian because, you know, if I'm the parent of a student who's really struggling, or if I'm a parent in a remote Aboriginal community, or if I'm a kid who's out in Western Sydney who's looking at never getting a job for the next few years, I just don't think the evidence base that's been put together is doing me much good. And so my feeling is that the evidence should be used to laser-like focus on some of the issues that we've got. It's not good enough that 80%, as you're saying, are succeeding. We need 100% to succeed. And if the evidence can only show us how to do it for 80%, then the evidence isn't enough. So, you know, I'm looking for the evidence that's going to break the cycle of 80% is good enough. And I don't think that we've quite got there yet. So I guess I'd be arguing I want a little bit more evidence of the bits that we're not doing well. That's not to say that a lot of people aren't doing lots of terrific things, but it is saying we've got more to do.
Sandra, I'd invite you to go to Catherine Primary School in the Northern Territory. Stunning, impressive with Aboriginal kids. I invite you to go to Rooty Hill High School in the Western Suburbs. Unbelievably excellent. I'd invite you to go to some of the special needs schools that are doing stunning jobs, schools working with these struggling kids. It's not unique to them. Our bigger problem is kids above the average. We're not as good with them. If you look at the evidence here in Australia and you take NAPLAN, for example, we're better with kids below the average. The evidence system is being implemented there even better. Take some of our brightest kids in the country. They are cruising. We're not so good. So be careful of your assumptions. I think we know an incredible amount how to deal with those kids. And I'm saying, I'm with you. 80% is not good enough. I want to change the world, not just a few kids. The argument is the direction that I'm talking about today, you have more chance of turning kids back onto learning, making schools a more inviting place to be than we have if we keep just perpetuating the status quo.
Well, I think, John, we agree at that point.
Heaven forbid. Look, you're all talking about evidence. Matt, Sandra, Yong, Jim, I'm still confused. What in your minds constitutes quality evidence? What's credible evidence? What does it mean?
Oh, I'm happy to go.
Go, jump in.
Quality evidence is about the triangulation across different sources of evidence from different interpretations, which means more than one person. It means standing in the shoes of others and seeing how they're interpreting the world. It means reflecting from the point of view of others. It's about having those examples from test scores, student work, student voice, all on the table, seeing how it comes together, and then having that massively important conversation about what are our expectations. I keep talking about at least a year's growth for a year's input. What does that actually look like in a classroom? We have, in the old days, we used to call it moderation. It was very expensive. I think there are much better ways to do it now. We need to put that on the table and say, this is the nature of it. When you introduce a new policy into a school as a principal or in a system as a director general or minister, you should be asking up front, what is the success criteria here? And you should be judging the quality of your policy by whether that evidence is showing that. Now, wouldn't that be a novel change in some systems? So that we say up front, what is it we're trying to value? And then I come back to Sandra's argument, and I'm 100% with you, Sandra. It's not just achievement. The biggest predictor of success in adult life is the number of years of schooling. which comes back to the fundamental notion is this school an inviting place to come to? And that we don't do as well on as we think we should. I want that learner profile you've talked about. I think that's an absolute critical part. And there's no one right answer, of course. But quality evidence is the evidence that shows the impact, not how you teach.
So it's about impact.
Yes, I don't care how teachers teach. I care about the impact of that teaching.
But
Okay.
might I add, Janet, I just want to quickly add something. Again, I think, John, we talk about there's evidence of doing good. There's also evidence of doing bad. So the same approach that can work, it can hurt. So that is, I think, we don't have enough evidence of the side effects in education. Yes, this has improved 1 year, but at what cost? So that's something I think we need to think about, because schooling, we would all agree, doesn't teach everything that's meaningful for everybody. It teaches a certainly predetermined set of things that may be meaningful for some people. So that's, I think, we're running out of time, but that's one point I would like to just add to that.
I agree. Side effects is critical, and looking at the multiple outcomes. But quite frankly, if I was a doctor, I would argue the same thing in patients. It is the side effects. It is the interaction and the treatment and the effects that the person's having that I need to be completely attentive to. That's the fundamental notion of evidence-based in medicine. And that's the fundamental notion I want here. Not the corpus of research, but how do you look at those implementation effects, those side effects, and how it works on each and every single student.
Okay, as you heard Yong say, we are running out of time. So what I want to do to finish up is to ask each of you to focus just for a minute on next week. The plan next week is to take all the key questions that we've looked at over the 3 episodes, bring them together in themes, and really use that to argue what next, what's coming. All of our participants in the webinar have put lots of comments, lots of questions, and those on our website. So in one sentence, and I mean one sentence, what I want you to do is to think about what a teacher, a leader, or a policymaker, or any individual might be able to do today to turn the tide. What's that individual going to do? And I want you to start your sentence with a teacher can or a leader can. Sandra, I'm going to turn to you first.
I think a teacher can focus on what the tools of trade they think a learner will need to thrive as a learner wherever they are at any time.
Thank you. Yong?
Well, I think a school leader and a teacher could ask those students who are not benefiting right now what they would like to do and offer some new options.
Thank you. And John, final word for you?
I want to ask teachers why they deny their expertise.
That wasn't quite what I asked you to do, but we'll let you get away with it because you're coming back next week. Jim, I think it's over to you now.
It is over to me, and you didn't ask me for my sentence, Janet, but my sentence is that we should turn over the obligation and the responsibility for evidence-based decisions to teachers and take them out of the hands of system and higher-end leadership, because some of the decisions based on evidence that get handed down don't engage teachers at all. And until we engage teachers and give them time, it won't happen. Thank you to everyone today. I thought it was a fantastic debate and discussion. Tremendous agreement, even amongst the diverse views of all of our panelists. So thank you, Matt. Thanks, John. Thanks, Sandra, and thanks, Yong. It was brilliant. As Janet said, next week is the culmination where we bring all of this together. Tuesday, 18th of August at 4 p.m. So we look forward to you being there, and certainly mention it to your colleagues. Can I thank you to all the people that did join with us today? We had well over 400 people, which was really fantastic. As I said before, this has been recorded. It's on our YouTube channel. And as Janet said, we are collating all the questions. So next week, we'll bring it all together. So without any further ado, thank you all for being part of this. And we look forward to our culmination next week.